This is Mental Illness Awareness Week. About 60 million Americans experience mental health problems in any given year. Less than a third will ever seek treatment. Dr. Joshua Weiner joins us this morning with the most common mental health issues and treatment. And we're hearing it more and more. Is it accurate that it's more and more, or are we just hypersensitive to this now?
Well, it depends. So certain illnesses do seem to be on the trend upwards. Things like pervasive developmental disorder or autism, there are increased rates of that over the years, as well as ADHD. But in general, I think what's happening is there's just increased awareness of these problems. So take, for instance, the issue of social anxiety disorder. There are a lot of people who suffer with social anxiety disorder. 25 years ago, those people, they didn't have a label to define that problem. These were just the aunts and uncles who wouldn't leave their houses, who always had to drink when they were social with people, who were always nervous whenever they were in a social situation. So now we have a label for that, treatments for that, and that's why it seems like more people are diagnosed with problems.
With that being one specific issue, what are others? What are the biggest ones that we're talking about?
So the most common mental health issues are going to be the anxiety disorder. So these would be things like social anxiety disorder, generalized anxiety disorder, post-traumatic stress disorder. But then the other thing are the substance abuse problems. So about 16% of the U.S. population has an active substance abuse problem, whether that's alcohol or other drugs. But you can also see here that about 2.6% of people have bipolar disorder, about 4% of adults have ADHD, about 20% of women at some point in their lives will suffer from depression, about 10% of men. So these are problems that affect almost everybody at some point in their lives, actually. They will meet criteria for one mental health disorder or another.
Now, we were talking, and you hear people all the time, I have to have my Xanax, I have to have my Ativan. Is that a cure?
No. So those are all just medications that can help treat anxiety. They do not cure anxiety, they control the symptoms of anxiety. And actually with those medications in particular, those are not typically the types of medications that you want somebody to be on long term, because there are lots of dirty, nasty stuff that can happen when you take those medications for a prolonged period of time.
Is there an age group that you find where people are most at risk?
The age at which people are most at risk for developing mental health issues is in their 20s. So it's interesting, that's the time when people might have their first episode of bipolar disorder, so they might have their first manic episode, they might have their first psychotic break, which is the beginnings of schizophrenia. I remember treating a woman years ago. She graduated valedictorian of her high school class, went off to college, had a psychotic break, and was never the same. So it's really scary, because people can be doing okay, and then all of a sudden, with a major stressor, boom, something clicks and it triggers.
Does it coincide with people at that age saying, hey, this is the formation of my life. I am now forming what my life is going to be, and some people just can't handle that if it's not going well?
Well, we think there's actually a combination of genetic vulnerability plus an environmental stressor. So not everybody with a genetic vulnerability will go on to develop a mental health problem. But if you combine the two, you have the genetic predisposition, and then you have some sort of stressor like going off to college, the loss of a loved one, whatever it may be, that can somehow trigger changes in your biochemistry and cause you to then develop these psychiatric issues.
So I know you advise people to seek help. Now, what can people do to decrease the risk of developing a mental health issue?
What I tell all my patients is that there are three things that are incredibly, incredibly important. One is diet. I think that people really need to try to make sure they're eating food that does not contain a lot of preservatives. Preservatives have been linked to things like ADHD and other mood issues. The other thing is sleep. Sleep is so critical. This cannot be overstated. I've even had patients who are psychotic, completely out of touch with reality. I give them medicine to make them sleep solidly for a good day or two. They come out of it, they're back to themselves. So people need to be getting more sleep than they are. And then the third one is exercise. People really are not getting enough exercise, and exercise has been linked to improved mental health, both with mood and anxiety. And maybe the fourth one to add is omega-3 fatty acids in the diet. People are going to get that if they're eating more whole foods, and that's been shown to have beneficial effects as well.
The phrase, get your mind right, easier said than done, but Dr. Joshua Weiner, thanks for providing some remedies.
Thank you, Keith.
Thanks for stopping by.